Well, good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikulu. First, the highlights. Health officials in Jigawa State impressed by turnout of residents for vaccination. Authorities say 160,000 people have gotten their jabs so far. Well, hopes dashed in Adamawa State as people report being turned back at vaccination centers owing to lack of jabs. Now, the foreign in Russia reports 1,235 coronavirus deaths in a 24-hour period. Reports over 250,000 deaths for a period of pandemic. The 45th week in the year is winding down, an indication that Christmas and New Year holidays are, as they say, just around the corner. But that's on the one hand. On the other, it's a note of caution and a reminder that as we plan to celebrate with friends and family, we must also factor in all the pharmaceutical and non-pharmaceutical interventions against COVID-19, a disease that thrives most when we gather together without taking precautions. Well, we're not taking our eyes off the virus, and here's what you need to know on the latest COVID-19 trends.
53 additional persons in Nigeria have been recorded as positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states and the FCT and indicate a drop from figures reported 24 hours earlier. Lagos had the highest number of infections with 19 cases. The FCT, Plateau, and Rivers each reported 7 cases. Imo and Kano had 5 and 4 cases. Zamfara came in with 2 cases, while Bayelsa and Gombe reported 1 case each. Today's report includes backlogs of cases from Lagos, Imo, and Kano states. Backlogs of recoveries were reported from Kano and the FCT, while 10 previous deaths in Edo were reported. No cases were reported from Delta, Edo, and Sokoto states. The total caseload in Nigeria has risen to 212,947. 325 more people were discharged, bringing the total number of recoveries to 205,000. There were 11 additional deaths from COVID-19 complications reported in the last 24 hours, increasing the total number of deaths to 2,933. Currently, there are 5,014 active cases in Nigeria, while over 3.3 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that more than 5.8 million Nigerians have received a first shot of the COVID-19 vaccine, while over 3.1 million persons have been fully vaccinated. Globally, more than 7.3 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 220,000 deaths recorded across countries on the continent.
Well, the Jigawa State Governor, Badr Abubakar, has put the total number of vaccinated residents across the state at over 160,000. The governor disclosed this while presenting the 2022 appropriation bill to the State House of Assembly. Our correspondent, Sadiq Ilyasu, has this report.
To curb the spread of the coronavirus pandemic, the federal government rolled out vaccines across the country. So far, in Jigawa State, 160,000 people have been vaccinated.
In terms of our preparedness and response strategy, I'm pleased to inform honorable members that we are doing exceptionally very well. As per the national statistics on COVID global pandemic, Jigawa State has the least cases and mortalities. We are also among those with the highest number of COVID-19 vaccinated, currently at about 160,000.
While others are still skeptical about the vaccine, the chairman of the Civil Society Forum in Jigawa says authorities need to do more to ensure that more people are vaccinated.
From the media, civil society, religious leaders, and of course the traditional institutions. So I think more effort needs to be put in place in ensuring that people are more into this collecting vaccine.
I come across some people whom earlier took the vaccination, complaining that they have some slight headache or fever or general weakness of the body. So honestly, that's what scared me of taking the vaccination until I met one professional health personnel.
Vaccination has been identified as the key to controlling the spread of the virus. The hope is that government ensures accessibility to the vaccine. Sadiq Ilyasu, Channels Television News.
Well, it's a mixed bag in Adamawa State, where healthcare workers say they're impressed with the turnout for vaccination, which they believe is a result of the awareness campaign by the state government. But there's one challenge impeding the exercise. The vaccination centers in the state have now run out of the Moderna vaccine supplies, although sources at the Yola Specialist Hospital say the AstraZeneca COVID-19 vaccine is still available.
At the Yola Specialist Hospital, some women who come for the vaccination are seen leaving the premises because, according to sources, the AstraZeneca vaccines being administered are out of stock. At the Malamri Healthcare Center, a few people trickle in for their first and second doses. Some cannot receive their second dose and are asked to return. They give their impression of the exercise.
I took the first one on the 24th of September, and I just took the second dose right now. Had no side effects, all the headaches and stuff, I didn't have anything whatsoever.
I came here October and I've done the first vaccine and I don't have any effect. I haven't experienced any effect. So I'm here for the second dose.
They also have their challenges.
A few months ago, while I was in Jalingo, I took the first dose of Moderna, and it was due on the 6th of November. But when I contacted them in Jalingo, they said they didn't have, but they have in Yola. So I'm here in Yola, and I'm here, but unfortunately, it's still the same situation they're expecting.
I was made to understand that whenever I'm due for the second dose, if I go to the villages and find them giving the second dose of the AstraZeneca, I can take it as well, not necessarily coming back to the base here where I took the first dose.
The head of vaccination, Malamri Healthcare Center, says the turnout has been impressive, although the lack of Moderna vaccine is regrettable.
So far, the vaccination is good. People are coming out to take the vaccine. We are out of stock of Moderna, but we are giving AstraZeneca first dose and second dose.
About 69,000 doses of AstraZeneca and 73,000 of Moderna were supplied to Adamawa State in the first batch, which was dedicated mostly to frontline workers, while the Moderna vaccines were for those with health challenges and the elderly. However, what is obvious is that though some people have received their first and second doses of both the AstraZeneca and Moderna vaccines, others will have to wait, perhaps an indefinite amount of time, as they expect new vaccine supplies to complete their COVID-19 vaccinations.
Well, let's further explore Nigeria's response to COVID-19. We're joined by Mr. Abiodun Oguniyi, who is the head infection prevention and control at the NCDC. Well, Mr. Oguniyi, thank you for joining us on the program. He joins us live from our Abuja studio, by the way. Well, we're approaching the festive season, and it goes without saying that people will travel from within and outside the country just to celebrate and spend time with family and loved ones. First, let me ask you, does the NCDC have any worries as the days approach?
Yeah, thank you very much, Kayode. It's nice to be here again. For us at the Nigeria Center for Disease Control, it's not about worry. It's about the need to intensify efforts, just as we've been doing, especially given the recent information released by the World Health Organization some days back, having declared Europe has a new epicenter for COVID-19, given the increase in the number of cases they have reported. And what does this suggest to us? We do say that the viruses don't move, people move them. And so as there will be increased travels, especially in this festive season, we anticipate that there will be a lot of movement. And that is why it's important for us to come back again to talk to Nigerians, as we have been doing. The need for them to also play their part in taking responsibility for their actions and ensuring that they help mitigate this outbreak as much as possible. Of course, we continue to work with the Federal Ministry of Health through the Presidential Steering Committee and other collaborators and partners to see how we can mitigate whatever the likely surge that may be anticipated. We know, for instance, the effects of the Delta variant that has had on the country, even other parts of the world. And this is just to let us understand that even though we have had a reduction in the number of cases that has been gradual increase, it is important to state that reduction does not mean no case again. And it only takes one case to begin the outbreak again. And so cases being still reported, and I'm glad we still see a lot of information being provided by channels and other media stations telling us that we still have cases being reported. And so with every case being reported, it's to tell us that there's potential for spread even through that case. Especially as people travel, we encourage as much as possible that people should follow all the travel protocols that have been put in place for travelers to ensure that they do their testing before they leave their country of origin, of departure, to Nigeria, for instance. And when they arrive in Nigeria, the necessary protocols have also been put in place to ensure that they get tested on arrival, 2 days or 7 days, as may be the case for vaccinated and unvaccinated persons, as soon as they arrive in the country. We believe that with measures about vaccination from their own part, the testing that they need to do before departure and on arrival, we will be able to at least bring aside those who are possibly having the viruses, strengthen the system. And for us as Nigerians also, one thing we'll also appeal is that this is not a time to continue the mass gatherings. I know there is temptation for Nigerians to be involved in festivities and all that in times like this. But we say that if that has to happen at all, let it be something that is done outdoors where there will be good ventilation. And also, we are not going to lose guard as respect to the request and the appeal for us to keep masking, to keep wearing our mask as much as possible, because the beauty of this whole interaction is that the same preventive measures are still very effective as long as we keep putting them to use. We still need to continue to wear our mask, even in those gatherings, if we have to gather outside, for instance, but definitely not indoor. One thing we have seen also with the Nigerians is that people just put the sign at the entrance of the event center, no face mask, no entry. But as soon as they enter, they remove the mask. The risk is actually inside. Not even much of them is higher inside, not even the outside that they are coming compared to outside.
I think it's important to keep making that point, really, because, we see that happen a lot. And you wonder, is the infection also staying outside? But, we need to reiterate those points you have made. But I'd just like to also clear an issue which we've seen past few days. We've seen backlogs. 2 days ago, there were a backlog of 8 deaths from Edo. Yesterday, backlog, I think 10 from the same state. And for a lot of people looking at the figures and wondering just what is responsible for that, as we wind down on this, can you just elucidate on that? Why is that so?
All right. So it has to do with the logistics with reporting across the states. The NCDC only reports data that are verified by the state and sent to us. And within the time of collecting their data and sending to us, some may not be reported real time. And because we have a time set to collect all data across the country, and we need to reach out to Nigerians to give them the daily update, if there is any delay in sending the reports to the national database by the states due to one logistic reason or the other on their side, then it becomes difficult for us to put such reports in the report for that day. And we will not be fair to add it to the next day. So it would be appropriate to say this was meant to be for 2 days ago or 3 days ago, but because of whatever delays, it got to be reported now. And that is why we say backlog. But we are improving efforts on this to ensure that we have improvement on our electronic data transmission processes so that this data can be reported real time. And we are sure that over time, we're going to get out of this. And as we tidy this up, it's important to let Nigerians know that as we go into the festive season, please, it is not a time for us to be afraid. Right. We can still continue to do our activities, but we need to stay safe and stay protected. Maybe use this opportunity to tell Nigerians, NCDC is committed to protecting the health of all Nigerians. Right. And we do this within our mandate to protect, to prevent, to detect, and respond to public health emergencies. We are not a fund distribution organization. We don't give palliative. People have been sending messages saying from NCDC, please let's desist from such. Let's ignore such messages. We continue to protect our health, doing evidence-based interventions to get Nigerians protected.
Well, Mr. Biodo Guni, that's a great place to anchor. Thank you so much for sharing your thoughts. Mr. Biodo Guni is a head infection prevention and control at the NCDC, joining us from our Abuja studio. Thank you.
Thank you very much, Kennedy. Thank you, Chinese, for all you do.
We'll go on a break now. When we return, we'll take a look at the partial lockdown plans in Europe, plus Russia recording record fatality within 24 hours. To join us again. Well, welcome back. Outside Nigeria, Europe has become the epicenter of the pandemic again, and causing some governments to consider reimposing lockdowns as the Christmas holidays approach, and a stirred debate over whether vaccines alone are enough to tame COVID-19. In Germany, infection numbers continue to hit new records every passing day, and this has led to serious concerns about public health and rising numbers of deaths. The question now is, just what kind of lockdown or restriction will the government introduce, and to what extent? So let's find out from DW correspondent Arthur Sullivan in Berlin. Well, Arthur, what is the latest in Germany? How bad have things gotten in terms of case numbers and hospitalizations?
The coronavirus numbers in Germany, unfortunately, have been getting worse and worse over the past few weeks. And in the past week, we have seen new infections, the daily rate of new infections, pass 50,000 for the first time. Also, the incidence rate, that's the number of new infections per 100,000 of the population over the course of a week, that has also hit record levels and is now approaching the 300 mark. So those numbers are very, very bad. In terms of hospitalizations and the number of patients in ICU units, it's not quite as bad as it was during peak periods of the pandemic last year, during the other waves, the second and third waves, although the numbers in ICU units are getting worse and hospitalization rates are increasing, which is obviously leading to concerns that if the infections are not curbed, that there will be more numbers in hospitals and soon units may be overwhelmed.
So if you could tell us, what is causing this huge rise in numbers, and is there any sign of it maybe easing off or being controlled?
There are a number of factors behind the huge increase in coronavirus infections and this fourth wave. Probably the biggest one is to do with the level of vaccination in the country. So the vaccination rate in Germany is about 67%, two-thirds of the population, which is reasonably high, but compares not so well with other Western European countries. And what it means in effect is that there are around 16 million German residents over the age of 12 who are unvaccinated, which gives the virus a huge amount of space in which it can spread and create new infections, because as we know from all the science, all the data, those who are unvaccinated have a much higher chance of becoming infected and also becoming seriously ill with the virus. And we can see that in the hospitalization rates and the ICU rates. Those who are unvaccinated are much more likely to end up in hospital, and that's the case in the German hotspots at the moment. That's the biggest reason. However, there are other factors. For example, it has gotten colder in Germany quicker than many people expected as winter comes in. That leads to people congregating more indoors, and the virus, as we know, particularly the Delta variant, spreads indoors. Then you have the question of waning immunity. So while all those people I've mentioned, the 67% who are vaccinated, many of those vaccinations happened in the early months of the year. And there are many studies which show that after 6 months or so, immunity from vaccinations does begin to wane. So there is a chance, therefore, of breakthrough infections of the vaccinated and people needing booster shots. And that booster shot campaign hasn't quite taken off in Germany yet. So there are some of the main reasons. Also, there's been less contact restrictions over the months as virus numbers, over the summer months, I should say, as virus numbers fell. And so there's a little bit of a catch-up game going on to try and deal with this wave while still maintaining the level of freedom that people have in their lives at the moment. And finally, it's important to say, it's not just Germany that's experiencing this surge at the moment. Several of her European neighbours, the Netherlands, the Czech Republic, Austria, Switzerland and other European countries are also experiencing very, very high numbers as a fourth wave takes effect across Europe.
So let's go to the government and policy level. The new German government has not yet been formed, with coalition talks, of course, ongoing. So do you think that might create further complications?
So at the end of September, there was a federal election in Germany and a new government was elected. Now, that new government hasn't quite taken shape yet. There are coalition talks ongoing between three parties. And while it is very, very likely that, in fact, almost certain that they will be the new government, the outgoing government are still the caretaker government and ostensibly in charge. Now, many commentators and politicians and political experts have said that this has created, to an extent, a little bit of a vacuum of leadership when it comes to combating the coronavirus. The thing about the virus is that events happen very, very suddenly, very, very quickly. And if they're not controlled and if measures are not taken quickly, then things can get out of control. And obviously, government formation talks are quite a large and important distraction, and so there hasn't really been the chance yet for the incoming government to get to grips with the latest surge of infections and the fourth wave. While they have discussed it, and the likely next Chancellor, Olaf Scholz, has discussed it at length and says that something needs to be done and has suggested various measures with his future coalition partners, there is certainly a sense that at the moment there's probably not enough leadership in Germany, and that's understandable, of course, but it needs to be changed quickly to deal with what is an escalating and serious public health crisis.
Well, DW correspondent Arthur Sullivan with the latest from Germany. Thank you. Well, still in Europe, the first lockdown measures in Western Europe since the summer is expected to kick off in the Netherlands, albeit partial. Well, a 3-week-long plan will see bars close early and people urged to work from home where necessary. Elsewhere, Russia has reported 1,235 deaths from COVID-19 in just 24 hours, its highest fatality toll from the virus. Here's more in our global update.
Russia has reported 1,235 coronavirus-related deaths in the last 24 hours, close to a record one-day toll recorded earlier this week amid a nationwide surge in cases. According to the official data, a total of 252,926 people died of coronavirus in Russia during the pandemic. The country has been experiencing a sharp increase in the number of daily infections from mid-September to the end of October. Since the beginning of November, new daily infection cases stopped around 40,000. Bars and restaurants in the Netherlands will close early and sporting events will be held without spectators under a 3-week partial lockdown expected to be announced. The measures are meant to contain a rapid surge in COVID-19 cases that is straining hospitals across the country. New infections topped 16,000 for the second day in a row on Friday, beating the previous record of just under 13,000 confirmed cases in a day set in December last year. Dutch broadcaster NOS said the first lockdown measures in Western Europe since the summer will go into effect on Saturday evening. German Health Minister Jens Spahn has announced that Austria will be classified as a COVID-19 high-risk area starting Sunday. The classification means that people traveling from Austria must enter quarantine upon arrival in Germany unless they have been vaccinated or have recovered from COVID-19. Germany's fourth COVID-19 wave is already stretching capacity in some hospitals, prompting doctors to say they will have to postpone scheduled surgeries and several states to tighten hygiene regulations. And finally, 2 foreign athletes have tested positive for COVID-19 during test events for the Beijing 2022 Winter Games. Both are luggers of the same nationality and have been transferred to quarantine hotels.
Or visit our website, channelstv.com, for more updates and a better understanding of the pandemic, plus other stories, all at your fingertips. And that's the COVID-19 update. Thank you for watching. I'm Kayode Okikiolu. Remember to stay